Hey everyone, today, let's talk about something most people ignore, your kidney health. Your kidneys are the body's master filters, working non-stop to clean your blood. When they start to struggle, the warning signs are subtle, often mistaken for stress or aging. Early detection is crucial. Recognizing these signs can help prevent serious damage. So let's break down 13 early signs of kidney failure you should never ignore. First up, fatigue and weakness. These are some of the most common yet often overlooked early warning signs that your kidneys might not be working as well as they should. Many people brush off feeling tired, thinking it's just a result of a busy lifestyle or not getting enough sleep, but when fatigue becomes a constant companion, it's time to pay attention. This isn't just being tired after a long day or a restless night, it's a kind of tiredness that lingers, no matter how much you rest or how many cups of coffee you drink. You might find yourself struggling to get through your daily routine, feeling like even simple tasks take more effort than they used to. It's a deep, persistent exhaustion that sleep doesn't fix. You may wake up in the morning still feeling worn out, or notice that you're running out of energy much earlier in the day than before. This kind of fatigue can affect your mood, your ability to concentrate, and even your relationships with others. When kidneys fail, toxins and waste products start to build up in your blood, making you feel drained and sluggish. Your body is working overtime to cope with these changes, and that can leave you feeling completely wiped out, both physically and mentally. Plus, your kidneys make a hormone called erythropoietin, or EPO, which signals your body to produce red blood cells. These cells are essential for carrying oxygen throughout your body, giving you the energy you need to function. When your kidneys aren't working properly, they produce less EPO. This means your body makes fewer red blood cells, leading to anemia, a condition that can make you feel even more tired, weak, and short of breath. Anemia can also cause headaches, dizziness, and pale skin, adding to your discomfort. If you're unusually tired and can't explain it, don't ignore it. Fatigue that doesn't go away with rest or that interferes with your daily life is your body's way of telling you that something isn't right. It's easy to dismiss these feelings, but they could be an early sign of kidney trouble. It's your body's way of saying something's wrong. Sometimes this fatigue is accompanied by other symptoms like muscle cramps, trouble sleeping, or even pain in your back or sides. All of these can be clues that your kidneys need attention. Persistent exhaustion is often the first sign of kidney trouble. If you notice that you're struggling to keep up with your normal activities, or that you're feeling more run down than usual, it's important to take these symptoms seriously and talk to your doctor. Listen to your body. Don't just push through. Early detection can make a big difference in managing kidney disease, so pay attention to what your body is telling you and seek help if you notice persistent fatigue or weakness. Next, swelling or edema, especially in your ankles, feet, or hands. Kidneys regulate fluid and sodium. When they're not working, fluid builds up, causing swelling. You might notice tight shoes, puffy eyes, or rings that don't fit. This isn't just from standing too long. Persistent swelling is a red flag. Damaged kidneys also let protein leak into urine, making swelling worse. If you see ongoing puffiness, it's time to pay attention. Don't just brush it off. Changes in urination are one of the most noticeable and direct signs that your kidneys might not be functioning as well as they should. Your kidneys play a crucial role in filtering waste and excess fluids from your blood, and when they're struggling, your body often tries to alert you through changes in your bathroom habits. Pay close attention if you find yourself needing to urinate more frequently than usual, especially if you're waking up multiple times during the night to go to the bathroom. This is called nocturia, and it can be an early sign that your kidneys are having trouble concentrating urine. On the other hand, if you notice a significant decrease in how much you pee, that's also a red flag. Take a moment to look at your urine. If it appears darker than usual, has a strong odor, or you notice it's foamy or bubbly, these could be signs of protein leaking into your urine, a symptom of kidney damage. Blood in your urine, even if it's just a small amount, should never be ignored. You might also experience discomfort such as a burning sensation, pain, or difficulty starting to urinate. Some people feel like they can't fully empty their bladder, or they may have to strain to get the flow going. These symptoms can be uncomfortable and are important warning signs that something isn't right. All of these changes suggest that your kidneys aren't filtering your blood and removing waste as efficiently as they should. When the kidneys are under stress or damaged, these symptoms often appear before any pain or other obvious signs. Even mild or subtle shifts in your bathroom habits can be significant. It's easy to dismiss them as just a part of getting older or being busy, but your body is trying to communicate with you. Don't ignore what your body is telling you. Ignoring these early warning signs can lead to more serious health problems down the road, including chronic kidney disease or even kidney failure. Make it a habit to track what's normal for you, and if you notice any changes, no matter how small, talk to your doctor. Early detection and intervention can make a huge difference in protecting your kidney health and overall well-being. Shortness of breath after even the simplest activities, or sometimes even while you're just sitting still, can be a warning sign that something is wrong with your body, especially your kidneys. Many people think getting winded is just a part of getting older or being out of shape. But when it happens suddenly or gets worse over time, it's important to pay attention. Your body is trying to tell you something. When your kidneys aren't working properly, they can't remove extra fluid from your body. This fluid can build up in your lungs, making it much harder to breathe. You might notice a feeling of heaviness or tightness in your chest, or you may find yourself needing to catch your breath more often, even when you're not doing anything strenuous. This is called pulmonary edema, and it's a serious complication of kidney disease. Another reason for shortness of breath is anemia, which is common in people with kidney problems. Healthy kidneys help your body make red blood cells, which carry oxygen throughout your body. When your kidneys are failing, you have fewer red blood cells, so less oxygen gets to your muscles and organs. This can leave you feeling tired, weak, and out of breath, even after mild activity. You might notice that you wake up at night gasping for air, or that you need to prop yourself up with extra pillows just to sleep comfortably. Everyday tasks like tying your shoes, walking to the mailbox, or even talking on the phone can suddenly feel exhausting. These are not normal changes and should not be ignored. Shortness of breath isn't always about being out of shape or not exercising enough. Even people who look healthy and active can experience these symptoms if their kidneys aren't working well. It can be frustrating and confusing, especially if you've always been able to do these things without any trouble. Both fluid overload from failing kidneys and anemia from low red blood cell counts can make you feel breathless. You might also notice other symptoms like swelling in your ankles or feet, or feeling unusually pale and tired. These are all signs that your kidneys may not be working as they should. If you notice new or worsening shortness of breath, especially if it comes on suddenly or is accompanied by swelling, fatigue, or chest discomfort, don't ignore it. Talk to your doctor right away. Early detection and treatment of kidney problems can make a big difference in your health and quality of life. Persistent, deep itching, especially all over your body, can be a sign of kidney failure. When kidneys can't filter waste, toxins build up and irritate your skin. Mineral imbalances like high phosphorus can also cause severe itching. This isn't just dry skin, it's a sign your whole system is out of balance. If lotions don't help and the itch won't go away, it's time to get checked. Don't ignore this uncomfortable warning. A constant metallic taste or ammonia-like breath can mean your kidneys aren't filtering waste. Urea builds up, breaks down into ammonia, and affects your saliva and breath. Food may taste off and your breath may smell foul. This is a clear sign of toxin buildup. If you notice these changes, don't just blame your diet. Get your kidneys checked. Ongoing nausea or vomiting, especially in the morning, can be a kidney warning. Toxins irritate your stomach and trigger nausea. If you feel sick for days without a clear cause and it's paired with other symptoms, it's time to act. Chronic nausea leads to weight loss and weakness. Don't ignore persistent stomach issues. Brain fog, confusion, or trouble focusing can be linked to kidney failure. Toxins and imbalances affect your brain, leading to memory issues and sluggish thinking. Anemia from kidney disease also reduces oxygen to your brain. If you notice ongoing mental changes, don't just blame stress or age, it could be a sign your kidneys are struggling. Take mental changes seriously. High blood pressure is both a cause and a result of kidney disease. Damaged kidneys can't remove excess fluid, raising your blood pressure. They also release hormones that tighten blood vessels and retain salt. If your blood pressure suddenly spikes or becomes hard to control, your kidneys may be involved. Regular checks are vital. Don't ignore new or worsening hypertension. It's a key clue to kidney health. Losing your appetite or feeling full quickly can signal kidney problems. Toxins, nausea, and hormonal changes all play a role. This can lead to weight loss and malnutrition, making you weaker. If you're eating less and losing weight without trying, don't ignore it. Appetite loss is a serious warning sign. Frequent painful muscle cramps, especially in your legs, can be a sign of kidney trouble. Kidneys regulate electrolytes like calcium and potassium. Imbalances cause muscles to spasm and cramp. Nerve damage from toxins can make cramps worse. If cramps are frequent and unexplained, get checked. It's more than just dehydration. Kidney pain is usually a deep ache in your flank, not your lower back. It can be caused by cysts, stones, or infections. Most chronic kidney disease is painless, but sudden or persistent pain in this area should be checked. Don't assume it's just a muscle pull. The location and type of pain matter. See a doctor for new or severe flank pain. Trouble sleeping is common with kidney disease. Toxins, itching, cramps, and frequent urination all disrupt sleep. Fluid in your lungs or sleep apnea can make things worse. Poor sleep adds to daytime fatigue, creating a vicious cycle. If you're struggling to sleep and have other symptoms, it's time to investigate. Don't ignore restless nights. Sleep issues can be a key sign. Your body is always sending signals. Don't ignore them. If you notice these signs, talk to a healthcare professional. Early action can protect your kidneys and your health. Share this video to help others recognize these warning signs. Public health starts with awareness. Thanks for watching. Stay healthy, stay informed. See you next time.